Thank you, Mr. Chair. You know, for months, we have been hearing the Republican majority talk about addressing waste, fraud, and abuse in our healthcare systems and in government systems writ large. One of the things I have found interesting in the discussions around waste, fraud, and abuse is that it curiously omits corporate waste, corporate fraud, corporate profiteering, and corporate abuse of public tax dollars all the time. And whether it's the failed audits of the Pentagon that get glossed over, whether it is the immense, and we've seen this, in plenty of oversight hearings on a bipartisan basis, defense contractors that are defrauding the public dime. But we have this in the healthcare space as well, particularly in the form of Medicare Advantage and what happens within Medicare Advantage. As many people know, Medicare itself is a health insurance program run by the federal government that covers people over the age of 65 and some people with disabilities. But Medicare Advantage is not the same thing as Medicare. Medicare Advantage is for-profit insurance. Medicare is public insurance. And listen, Medicare Advantage plans can be popular at first. These insurance companies will make the health insurance plans look good because up front, when you're healthy and don't need to go to the doctor, it looks like you save a few bucks compared to Medicare. But then when you get sick, that's when the sky falls down. That's when costs skyrocket. And when you really need care, you either can't get it in Medicare Advantage or you have to pay so much more out of your own pocket on a program that's ostensibly supposed to be done with public dollars. And these Medicare Advantage programs, the reason this unfolds in this way is because they are run by for-profit insurance companies. Companies like Cigna, Humana, and United Healthcare. They will take public taxpayer dollars that are intended for caring for Medicare-eligible populations, and then they will take all of that money. They will make people look sicker than they are because there's an incentive to what is known as upcode, and then they pocket the difference because they will deny people the care that they need. Traditional Medicare, real Medicare, pays doctors and hospitals directly for the medical services they provide. Medicare Advantage is a middleman that denies people care, then upcodes them to make them to look sicker, and then they pocket all of that public money, they pocket the difference in their own profit to pay their CEOs and to yield shareholder profit. And then when people actually do need more care, private insurance companies under Medicare Advantage don't want to pay for it. And all of this adds up to private insurance companies under Medicare Advantage taking somewhere between $80 billion and $140 billion per year from the federal government that they then pocket in their own profits. That's a lot of your waste, fraud, and abuse margin right there. $80 to $140 billion per year. So my amendment today is a fusion of several Republican and Democratic-supported pieces of legislation. Today, I would like Representative Ruiz and myself are offering up the bipartisan No Upcode Act, originally presented by the Senate Health Committee Chair, Senator Cassidy of Louisiana, as an amendment to this bill. It will go after that $80 to $140 billion in corporate waste, fraud, and abuse, and then it will take that money back in what's being pocketed, and it will reinvest it in actual Medicare and health care for everyday Americans to get enhanced and better health care that they need and deserve. It will save American taxpayers an estimated $124 billion over 10 years. It is fiscally responsible. Those savings, instead of going to tax breaks for billionaires and corporations will then be reinvested in Medicare. This reinvestment in funds, which is from a bipartisan policy championed by my colleagues, Representative Ruiz. In fact, we have a Republican representative who is also a co-sponsor on that bill, will ensure doctors are receiving adequate payment for the life-saving services that they provide, that our seniors and people with disabilities get the care that they need, and that profiteering companies no longer are getting away with this loophole. So I hope we can all agree on that. And I yield back.